Greetings, and thank you for joining us today as we take a look at the future needs of California's middle-income older adults. My name is Megan Burke, and I'm the Program Officer of Policy and Advocacy at the SCAN Foundation, an independent public foundation devoted to transforming care for older adults. We envision a society where every older adult has a set of choices and opportunity to age well in both home and community. And when the SCAN Foundation talks about aging well in home and community, we need to be clear that we're not saying that people are staying in one's home and being isolated. It's really about being able to have your total health and social needs met in your community, at home, as you need it. So to achieve this vision at SCAN Foundation, we have three goals. We want to strengthen the aging and health infrastructure, enhance financial ability to age well at home and community, and ensure equity in aging for all. Throughout the work, we emphasize three communities: older adults with lower incomes, older people of color, and older residents in rural communities. And we know that if we improve the aging experience for these priority populations and their networks of support, we'll improve it for everyone. So I think we all can agree that most older adults would prefer to receive ongoing living assistance at home or with loved ones. Yet we also know a majority are unable to afford and access the services and supports they need within homes and community. This, among other reasons, is why the foundation has been deeply involved in working with the state on its master plan for aging. And while health, housing, and financial well-being are inextricably linked, especially for the older adult population, existing systems and supports across these sectors are typically siloed, limiting innovation, the opportunity to deliver coordinated or integrated services, and exacerbating inequities for our priority populations. The intersection of health, housing, and financial well-being is especially poignant for the forgotten middle. Solutions need to be advanced to build systems that are accessible, convenient, affordable, integrated, and personalized, reflecting people's needs and preferences to age well at home and in community. And as part of the Village movement, you all today are doing the work to address these issues as part of that larger aging ecosystem. So today I'm joined by Kristen Hyashi from NORC to discuss with you the needs of California's forgotten middle, those 1.6 million middle-income older Californians who within a decade will struggle to afford long-term care and housing and will not qualify for Medicaid to really help with those costs. In 2019 and again in 2022, NORC completed two groundbreaking studies to better understand the nation's forgotten middle. Then with support from West Health and the SCAN Foundation, NORC took a closer look at how the number, demographics, health status, and financial resources of California's middle-income older adults would change over the next decade. So with that, I'm going to turn it over to Kristen to share more about this data that was collected as part of the California study and the challenges facing the forgotten middle, which honestly may include the majority of us here today and many of our loved ones right now. Thank you. Turn it over to you, Kristen.
Thank you so much. And many thanks to Village Movement California for inviting NORC at the University of Chicago to share this really important work. I've been working on the forgotten middle research since I started at NORC about a year ago, and it's definitely some of the most impactful work I've engaged in. And I'm delighted to have the opportunity to share the findings with you today. So I want to talk about a group we call the forgotten middle, which consists of middle-income older adults in the United States. NORC started this work back in 2017 with the National Investment Center for Seniors Housing and Care. And the first study that really coined the term, the forgotten middle, was published in Health Affairs in 2019. And it was really the first time anyone had really looked at this population nationally and defined their demographics, population size, health needs, and financial resources. And so what we did was we took 2014 data from the Health and Retirement Study and projected 15 years into the future to better understand what the needs of these adults would be in 2029. The study was very well received. I think many folks were surprised that this is a group that hadn't been described or well defined before, and that there was really no national long-term care plan for these individuals. So last year, we partnered with the SCAN Foundation to refresh that original analysis with 2018 data, forecasting nationally to 2033, with the goal of really trying to understand as more baby boomers age into the 75 plus group, what will their needs look like? Often there's a focus in senior housing discussions on low income individuals, which is super important. But one of the reasons we focused on the middle income older adult group is that in some ways, when we think about long-term care, this group often has the fewest options available to them in terms of paid housing and caregiving. We know, for example, that higher income individuals have the means to pay for a whole range of care options, and that low income individuals may qualify for Medicaid or Medi-Cal in California. So we're left with this group in the middle that just does not have the financial means to pay for long-term care and likely does not meet the eligibility criteria for Medicaid nationally. So when we did this analysis nationally, we intentionally set lower bounds conservatively to exclude anyone who might be eligible for Medicaid nationwide. And when you look at those upper and lower bounds, that's a combination both of income and assets annuitized over the expected lifespans of these individuals. These lower and upper bounds represent the 41st to 80th percentile of income and assets for these groups. And you can see that the specific amounts of income and assets vary a little bit based on the age group. So in our latest refresh, what we found was that the size of the middle market is going to nearly double, reaching 16 million middle income seniors by 2033. And while not all of them will need additional health and caregiving supports, the data indicate that at least some of them will. We see, for example, already in the data that many people will have special health needs, mobility limitations, or cognitive impairments that may impact their ability to live independently or stay in their homes. And while we know there are a range of caregiving options, one of the things we wanted to look at is if people decide that they can't remain in their homes and they need to move into an assisted living facility, will they have sufficient financial ability to pay for that kind of care? And what we found was that, unfortunately, 3/4 of middle income seniors nationwide, that's 11.5 million people, are unlikely to have sufficient resources without selling their home. And as I mentioned, there are many options for long-term care, including in-home supports, and we'll talk about some of those in a little bit. So when we did the first two studies at the national level, we took HRS data, we forecasted out 15 years into the future, and we presented those results at the national level. However, we heard that not all of these findings were applicable to California, that it's just such a different market from the rest of the United States. And so we partnered with the SCAN Foundation and West Health to recalibrate our national model to reflect a California-only population sample. And the data really highlights how California is different, such as being significantly more racially and ethnically diverse than the nation as a whole. We see different educational distribution in California, with both a higher percentage of people with less than a high school degree and a greater proportion of folks with a college degree. So it's kind of more of a polarized educational landscape. And we know that education is one of those key variables that can really have a significant impact on people's financial stability and savings long term. California middle income seniors are also less likely to have children living in the home or nearby. And as we know, after spousal support, adult children are key caregivers in this landscape. Oops. Sorry about that. Lastly, as you all know very well, and I do too, because I'm from California myself, it's just a very expensive market. You can see in the chart on the right side, it shows the stark contrast between California and national average costs of housing and care. So I want to take a moment to talk about some of the findings from our California specific analysis to show how they compare to findings from our national studies and to explore how the characteristics and resources of California middle-income seniors are projected to change over time. So in our California analysis, we found that California is expected to have roughly 1.6 million middle-income seniors age 75 and above by 2033. This is a 60% increase from 2018, when California had just over 1 million seniors in this group. It's also worth pointing out that the population of seniors over age 85 is expected to more than double during this time. And this is a really important data point, as we know that once individuals turn 85, they are more likely to need caregiving and are less likely to live independently. From a race and ethnicity standpoint, the data show that even in 2018, which was the most recent HRS data available at the time of the study, we see that California is much more racially and ethnically diverse than the rest of the country. In California, about 34% of middle-income seniors are people of color, which is projected to grow to nearly 50% by 2033. And that's compared to just 22% in 2033 nationally. And you can see that breakdown for California on the right in green. It's 29% Hispanic, 13% other, which is predominantly comprised of Asian Americans, and 5% Black middle-income seniors. And this is a really crucial point as we move beyond defining the problem and really start to think about housing and care solutions for the middle market. Policymaking will really require high levels of cultural sensitivity and cultural competencies to ensure that the needs of this diversifying population are adequately met. So once again, we recognize that not all middle-income older adults will need caregiving and support. However, the data shows that a considerable number of these older adults are expected to have fairly substantial health and functional needs. We project that a majority of California middle-income seniors will have mobility limitations or more than 3 chronic conditions by 2033. And the way that's defined in the HRS, that's about half of the chronic conditions that they're tracking. So it's not insignificant. We're looking at about 21% that are projected to have cognitive impairments, which we know is a challenge that makes it really hard to live independently. And all of this data goes to suggest that at least a subset of the middle market is likely to need care and support. Moving on to familial support. We know that families provide a lot of caregiving. So we wanted to understand what the composition of families looks like right now and how it may change over time. On the left, when you look at Californians over 75, fewer middle-income seniors will be married by 2033. This is due to demographic changes in marriage and divorce patterns in the baby boomer population. But that 10% percentage point decrease in those who are expected to be married or have a living spouse is a big deal, with spouses often providing a lot of the caregiving for this group. On the right-hand side, we include proximity to children in 2018 and see that 43% do not have children living nearby. Again, these are folks who don't have many unpaid options to rely upon without the support of spouses or adult children. So now that we've talked a little bit about how many of these older adults will need support and may not have the option of family members to provide that support, let's dig into their financial resources. Here we look at middle-income California seniors and disaggregate them into quintiles to give you a sense of how their resources are distributed. You can see that income is the biggest financial resource for the first 4 quintiles. Most have incomes between $30,000 and $45,000 a year. They do have a small amount of savings in the form of assets, which may include things like a 401k, ranging from about $4,000 up to about $24,000 to be used on an annuitized basis. We'll get back to housing in the next couple of slides, but in general, housing equity is relatively modest and is most relevant in that highest quintile. So now we move to look at the ability of these middle-income seniors to actually pay for private care in California. And to do that, we first have to start with the question of how much it's going to cost. So we estimated that assisted living rent plus annual medical expenses, which includes out-of-pocket costs, plus premiums for Medicare, is about $75,000 per year on average in 2018 dollars. When we apply that 75K threshold to the distribution of middle income seniors, we see that nearly 90%, that is 1.4 million California middle income seniors, are not likely to have enough financial resources to pay for assisted living, assuming they do not sell their home. Now, that last part is a big caveat, and it's an important one to understand. In many cases, individuals may still have a spouse or children that are living in the home, and so it may not be available as a financial resource to support long-term care needs. We also know that many families try to keep their home as a nest egg. In real life, people don't know how long they will live, so they want to have an insurance policy for any unforeseen events. However, even if we assume that these seniors are able and willing to sell their home and use the equity to contribute to their long-term care costs, we still see that nearly half of California's middle-income seniors will not have sufficient resources to pay for this kind of private care. Now, up until this point, we've been talking primarily about people who will not qualify for Medi-Cal. But we do know that the real solution for a lot of these individuals is that they delay their care, their health deteriorates, and at the point where they need care and they've depleted all of their financial resources, they qualify for Medi-Cal. We're not going to get into this too much today, but as part of the research that NORC undertook for California's middle market, we did a deep dive on the near-dual population, which we defined as individuals with incomes between 139% and 400% of the federal poverty level. These are people who, if they begin to have significant healthcare needs, they might begin to spend down to Medi-Cal. We were specifically looking at this part of the analysis only with income as a financial resource, since that is what will be used to determine Medi-Cal eligibility. And what we found is that these individuals actually make up a significant portion of California's overall forgotten middle, with about 1 million in this near dual category. And more than a third of those will be over age 85, indicating higher levels of care will likely be needed. So I want to shift gears a little bit right now and take a look at how these data points could potentially look for actual individuals in a few illustrative case studies. So NORC is very big on data. Our team is comprised of a lot of data nerds who find the charts and graphs we just shared really compelling. But we also know that behind the HRS data are real people. And if you're someone who responds better to a human story, we've drawn some actual respondents from the Health and Retirement Study. Again, these are real individual respondents from the HRS that we've given names and photos to give them more of a personal touch. And then we've completed a picture of them to give you a sense of what their health situation is, what their family situation is, and what their care needs might be. I want to point out quickly that we did 5 case studies. We'll only get to a few today, but you can find the full slate on NORC's website. So first, I'd like to tell you about Maria. She's a college graduate, she's married, and in 2018, when she responded to the survey, she was 61 years old. By 2033, she'll be 76. She's expected to still be married at that time. Her husband will be 88 years old in 2033, and she's also living with her children. Maria has already shown some mild cognitive impairment in 2018, and we anticipate that by 2033, her cognitive function is on the decline, and she's diagnosed with dementia. Although her children do live with her, they work full-time, and so they're not able to take care of her during the day. Her husband has some chronic conditions with ADL limitations, so he can't provide the kind of care that Maria may need as her dementia progresses. While Maria has low medical costs in 2018, we project that those costs will begin to rise modestly, though we do see sometimes that when folks have dementia, they can otherwise be healthy, and so we see those costs rise to about $1,400 a year. So after we remove her projected medical expenses, that leaves her just shy of $80,000 in annual financial resources to pay for additional long-term care needs. That sounds like a decent budget that should be able to provide a lot of coverage, but as I've mentioned, and as you obviously know, California is a very expensive market. And those regional markets across the state can vary pretty significantly as well. So if Maria were to live in El Centro, she could pay for full-time personal care services for about $39,000 a year, which is about half of her financial resources. But in San Francisco, that cost goes up to $78K, which would really deplete nearly all of her resources. If the family decided that it was really challenging for Maria to remain in the home and ultimately she needed to move into an assisted living facility to support some of her memory care needs, then interestingly, the costs between El Centro and San Francisco become more similar. She has enough resources to pay for it, but it would be really stretching those resources. Now, let me introduce you to Glenn. Glenn was 66 years old in 2018, and he'll be 2033. In 2033, he'll be 81 years old. He's widowed and does not have any children living nearby and does not own his own home. He had some mobility limitations in 2018. His health continues to deteriorate, and he really is going to need help with his ADLs in 2033. His medical expenses are increasing, and he does not have supplemental coverage. So out-of-pocket medical expenses before premiums is about $2,000 a year, and even that feels conservative. While he's doing okay, he simply doesn't have anyone to provide unpaid care should he need it. And so he only has annual financial resources of about $35K after paying for his medical expenses. If he were to need a home health aide, he would not be able to afford that in either Redding or in Santa Cruz. He'd fall short of that by more than $40,000 in each of those areas. Similarly, if he wanted to look at a private assisted living, that would be $50,000 in Redding and about $63,000 in Santa Cruz. And again, he would not be able to pay for those. So Glenn is a really good example of what we're describing, someone who has some financial resources to support his long-term care needs, but really not enough to pay for the true care that he needs, especially in a California market. So he's likely just to go without, or potentially he'll get by with a much reduced set of supports that doesn't adequately meet his needs. And finally, we have Angela. Like Glenn, she's widowed, she has no children living nearby, and she does not have home equity. At the time of the survey, she was 67 years old and will be 82 in 2033. She has some mobility limitations in 2018 and fairly low overall medical costs. However, by 2033, her mobility is on the decline and she's assessed to be at a very high fall risk, which puts her in a particularly precarious position without having any family caregivers. After medical costs, Angela's financial resources amount to a little under $26,000 per year. So if she has a fall that results in needing personal care services, we can see that she's short anywhere between $35,000 and $42,000 living in Visalia or Los Angeles, respectively. And if she has a major medical event which impedes her ability to remain in her home, she's similarly unable to afford assisted living costs in either of those areas. She's just an example of someone who, with just one serious medical event, could spend down to Medi-Cal. So that concludes our presentation for today. On behalf of the NORC team, I just want to thank the SCAN Foundation and West Health for funding this critical research, and a big thanks to Village Movement California for allowing us to share the findings with you today. It's been a true pleasure. Thank you.